Let me give you 5 examples of typical call to action instances or buttons on a medical website. The first one would be make an inquiry. That's an easy one, right? So you want to guide patients to take the next step, which could be make an inquiry. And the more you make that an accessible feature on your website, the more likely that people will actually use it to ask a quick question. You can insert it at various places on your website, not just at the top right end, so people need to look for it, but actually in the process of reading your content, it's there as a button, make an inquiry. A second example would be check if you're a candidate. If you're offering elective types of treatment, then you can allow this visitor, this prospective patient, to start the conversation. Now, of course, the button and the website will not tell them straight away, hey, because you filled out this form, you're now booked for this surgery. You can't do that. We cannot do that. But it can start a conversation that starts as an email and continues as a phone call from your receptionist or your practice manager. So check if you're a candidate. Start here. It's as simple as that. What do we start? Well, we start the process of taking the conversation to the next level, which again could be just leaving your details so the receptionist can call you back to explore if you have the right referrals, if you are actually in the right position to explore this kind of treatment. You can never be seen as pushing unnecessary treatment because of the APRA guidelines, you know that. So start here is a pretty neutral call to action that allows you to move this visitor to the next stage from just being a passive visitor of your content to an active conversation partner. And as you are marketing your private practice, you will see that when you start moving more people into that funnel, it's a marketing funnel, more conversations will lead to more conversions. So start here. Example number 3 of the call to action. Number 4, watch a video. We all know video is a great format to build rapport, to have a personal conversation, and using a short video on your website, again, takes the visitor, potential new patient, to the next step, which is to hear you speak, to hear your voice, to see your body language, to have that eye contact. And just like you've clicked this video, your potential referrers, GPs, or your patients will do it, and you'll see it'll trigger more conversations. And number 5, get my ebook. Now, I know what you're thinking. I don't have time to write an ebook. An ebook can be as short as 5 or 6 pages, giving extra value, educational content on the topic that is obviously linked to your specialty. So again, allowing the visitor to become a conversation partner because they will leave their email address. Your marketing system will send them the copy of the ebook. Your receptionist will get a notification and know, hey, what if we called this person next week and asked, hey, just wondering, how did you go with the ebook? Do you have any other questions? So those are 5 typical call to action mechanics you can start using on your medical website today to increase your conversion rate as a doctor in private practice.